Have you ever wondered why people that lie on the same position for a very long time develop injuries? In this video, we are going to find out. Now, there's what we call pressure ulcer or pressure injury. And you may like to know what pressure ulcer is. So if that looks like what you are interested in, do well to watch this video to the end. And if it's your first time of coming to this channel, do well to subscribe so that you won't miss out on any of our updates. First of all, we would define pressure ulcer. Pressure ulcers or pressure injury refers to the damage to the skin and or the underlying tissues over a bony prominence resulting from prolonged pressure or friction. Moisture could also be a problem in this case, because moisture can also cause a pressure ulcer. So each time a patient has physical immobility and lies down or sits at a particular position for a very long time, it could predispose the patient to what is known as pressure ulcer or pressure injury. Now, there are different areas of the body where we have bony prominences, and these areas of the body are prone to what we call pressure ulcer. So if you have a patient that has physical immobility or impaired physical mobility, you want to make sure that this patient does not sit or lie in one position so that he doesn't have pressure ulcer. Now let's look at the places in the body that could be affected by pressure ulcer. The common sites include the occiput, that is the back of the head. You could also find another site at the scapula or at the sacrum, which is the butt area. The sacrum and the coccyx are places whereby pressure ulcers could develop. It could also develop behind the knees, or you can also find it at the heel of the patient or even at the ankle region. And then coming back to the upper part of the body, there is also a pressure area which is the elbow. So if care is not taken, the patient can also develop pressure ulcers on the elbow. Even behind the wrist here, there is also a great risk of developing pressure ulcer if you don't nurse this patient very well. And what causes this pressure ulcer? Like I said in the beginning of this video, it is pressure due to prolonged lying down or moisture, and also friction could cause this. So when nursing your patient, you make sure you avoid these three things that could cause pressure ulcer for your patient. Otherwise, all roads lead to pressure ulcer. Now let's talk about the pathophysiology of pressure ulcer. This is what happens to the body and it develops pressure ulcer, and how the pressure ulcer progresses. Let's see how it goes. Sustained pressure over a bony prominence compresses the blood vessels, and when this happens, it leads to low blood supply to the tissues under in that area. And when there is reduced blood supply, it leads to reduced oxygen, reduced nutrients, and reduced glucose to that area. So that area begins to die off, and when it dies, or when it starts having ischemia refers to reduced blood flow to an area of the body. So when this ischemia happens, it kind of causes tissue death to that place. So when there is tissue death, the skin is now exposed to different types of infections that will prolong the matter further. So you see why pressure ulcers are very bad. You don't want your patient to have pressure ulcers at all. Now let's go further and look at the stages of pressure ulcer, because each time you have to deal with pressure ulcer, you have to classify it into different stages, and we have 4 stages of pressure ulcer: the stage 1, the stage 2, the stage 3, and the stage 4. So we'll be looking at each of these stages one after the other, so that each time you see a patient with pressure ulcer, you will know which stage it belongs and you will know how to manage it better. Let's go. For the stage 1 pressure injury, you will find a non-blanchable erythema. That sounds too heavy, right? Erythema refers to the reddish discoloration of the skin due to inflammation. Now, excess pressure and friction can cause inflammation in the skin. So when we say an erythema is non-blanchable, it means that when you compress that area, it doesn't turn from red to white. That is what it means. A non-blanchable erythema that could be painful or painless depending on the patient's condition. And again, you find that that area could be hotter or colder than every other part of the body or every other part of the skin in that area. Let's say if there is a non-blanchable erythema around here, you find out that here could be hotter or colder than other parts of the skin. But in the case of pressure injury, it is usually colder than other parts of the skin. Now, let's go over to stage 2. When it gets to stage 2, there is a visible wound in the sense that the epidermis is affected. Remember, the skin has 3 layers: the epidermis, the dermis, and the hypodermis. Let me know in the comment section if you want me to talk about the anatomy of the skin. And in my next video, I will be doing that. But for now, let's continue with stage 2 pressure ulcer. Like I said, in stage 2 pressure ulcer, the epidermis has been affected. So you find out that there is an injury to the epidermis, and the dermis is what you find in the skin, only the dermis. The epidermis has been eaten by the pressure ulcer. So we can call this condition partial thickness skin loss. It means that not all part of the skin is lost, but there is a part, but the toppermost layer has gone out. So call it partial thickness skin loss. Remember stage 1, non-blanchable erythema and the skin is intact. And in stage 2, the epidermis has been washed away. Now let's talk about stage 3. In stage 3, you will find full thickness skin loss. That is to say that it has moved from the stage of non-blanchable erythema to stage 2, which is the stage where the epidermis is lost. And then in stage 3, the epidermis is lost and the dermis is also lost. So what you find at that point in time is the subcutaneous layer, which is the fatty layer of the skin. It shows that this pressure ulcer or pressure injury has progressed from stage 1 to stage 2 and it has gone to stage 3. Now, let's talk about stage 4 pressure ulcer, which is the terminal stage pressure ulcer. At stage 4, there is full thickness skin loss. That's to say that the dermis, epidermis, and the hypodermis or subcutaneous layer of the skin has been eaten away. An injury to the underlying tissues, which are the muscles, the tendons, and the bones. You find out that these tissues are exposed, the muscle, bones, and the tendons. These tissues are exposed, and at this stage, the patient is prone to complications like septicemia and osteomyelitis. So you don't want it. So even if pressure ulcer has started, you don't want it to progress to this stage, because once it has gotten to this stage, it is more difficult to manage and it carries more risk. So you don't want that for your patients. Now, let's look at how we can manage pressure ulcer. In managing pressure ulcer or pressure injury, we classify the management into 3, which is pressure relief, wound care, and infection prevention and control. So we'll be talking about these branches of the management of pressure injuries. Let's talk about the first step, which is pressure relief. Now, to relieve your patient from pressure, you want to reposition this patient every 2 hours. You find that even you yourself that have your physical mobility, you are well, you can't lie down at a particular spot for more than 2 hours. You find yourself turning to another position. So this is what you need to do for your patient so that the pressure will not build up in one point of the body, in one part of the body. So do well to reposition your patients. I've done a video about positions used in nursing, so I'll drop the link here so that you can go and see that video for yourself. And if you've watched this video up to this point and if not subscribed, it means that you will miss out on my next video and you don't want that for yourself. So do well, like this video and subscribe so that you won't miss out on the next video. Now, also to relieve pressure, you can use pressure relieving mattresses like the airbed or the waterbed. For me, my attention is focused on the airbed. Unlike the conventional mattress that is made of foam, the airbed has a way of relieving pressure. You find out that much pressure won't be mounted on that area where there's a bony prominence. So when you use the pressure relieving mattress like the airbed plus repositioning of these patients, I assure you that there will be a lower risk of developing pressure injuries. Now, let's look at wound care. Wound care usually comes from stage 2 and above. So if your patient is in stage 1, you can manage it using the pressure relieving method. But once it has entered stage 2 and progresses further, you must manage the wound. And to manage this wound, you must change the dressing daily and clean with a sterile solution, preferably normal saline. This wound should be dressed with normal saline, and then the dressing should be changed. You could use different types of dressing depending on institutional policy or what the doctor prescribes. Maybe you could use honey, you could use betadine, or any solution that the doctor prescribes for you to manage that injury. Now let's talk about infection prevention and control. For infection prevention and control, the first thing to do is to, number one, you have to avoid moisture. Even before the pressure injury starts, avoid moisture on the bed, moisture and crumbs. The moisture plus the crumbs will cause havoc, and you find out that the patient will start developing redness of that area. So you don't want any form of moisture in that area. You also monitor the patient and manage continence. If a patient has urinary or fecal incontinence, you want to manage that properly so that moisture will not build up in the sacral region or the butt area. Also, each time you want to dress this wound, make sure you ensure aseptic technique while dressing the wound. Make sure that everything you're using is sterile, from your hands to the instruments you are using, and also the dressing you'll be using for this procedure. Make sure that it is sterile. Otherwise, you introduce microorganisms to that wound and it could cause more problems. You also want to emphasize on proper nutrition so that it will aid healing and boost the immune system so that there won't be further damage done to the skin. Now, to prevent pressure ulcer, I've said it countless times in this video and I'll repeat it again. Relieve pressure always. Try to reposition this patient every 2 hours. I've done a video about positions used in nursing, so I will leave the link there again so you can see that video and know the different positions you can put your patients. And mind you, do not reposition a patient alone because of what we call ergonomic back strain. I can do a video on that for you so that you know how to lift a patient. You also want to maintain proper hygiene and keep the patient's bed free from moisture and crumbs. Crumbs will lead to friction, which could cause a pressure ulcer. That will be the end of this video for today. So if you have any topic you want me to talk about, do well to drop it in the comment section. But for now, like this video, subscribe, and share to your loved ones. Share to your colleagues in nursing school so that they won't miss out on my subsequent updates. Bye for now.